Hello. It's been recommended that you need to wear a velcro compression device to improve the blood flow in your legs, either to reduce any leg swelling you may have, to treat leg ulcers, or to stop ulcers from returning. Long-term leg swelling and leg ulcers can be caused by faulty valves in the veins in your legs. Faulty valves can lead to increased pressure and fluid retention. Over time, this will cause damage to the surrounding tissue in your legs. This video will talk you through how to correctly fit and remove your velcro compression devices. It's important that you wear the compression device all day, every day to get the most benefit. You should put them on when you wake up in the morning. Before you put on the compression device, you may need to put on a compression anklet sock. Depending on the amount of leg swelling you have, your nurse will advise you whether this is best worn underneath or over the top of the compression device. If you need to wear it underneath, put it on now. Next, you need to put on the undersleeve by sliding it over your foot and onto your lower leg. The bottom cuff should cover your heel and the top edge should sit above your knee. Make sure that there are no wrinkles in the sleeve. Next, place the velcro compression device at the back of your lower leg, with the black side facing your leg. Unroll the top two bands and loosely secure them to the outside to anchor it in place. The compression device can then be moved into the correct position. It should sit just above the ankle bone at the base and beneath the knee crease at the top. To secure the device in place, unroll the bottom two bands and attach the bottom one to the outside, whilst holding the next band up out of the way. Once the bottom band is in place, you can work upwards, attaching one band at a time until all bands are tightly secured. There are a few steps you need to take to ensure the compression device is correctly fitted. Firstly, check the bands are attached in an alternating order. Next, check that there are no gaps, creases or wrinkles and it is laid flat against the leg. The bands can be adjusted as necessary to correct this. It should feel firm but comfortable. To make sure the device is tight enough, you will need the BPS card that came with your compression device. You will also need to know your recommended level of pressure, which your nurse will tell you and will write on your BPS card. Hold the card against the leg so that the two lines on the card line up with those on a band of the device. If the lines on the band are wider than the recommended range on the card, then it is too loose. Tighten the band until the lines match. If the lines on the band are narrower than your recommended range, then it's too tight. Loosen the band until the lines match. Check and adjust each of the 4 velcro bands for the correct level of compression, starting from the band nearest to the ankle. Once the correct fit is achieved, turn the edges of the undersleeve over the compression device. If your nurse has recommended wearing the compression anklet sock over the device, put it on now. Again, it is important to check that there are no wrinkles. To remove the device, take off the ankle sock. Next, unfold the undersleeve from the top and bottom. Detach the velcro bands, starting at the top. Fold each band back on itself to keep the velcro clean. Remove the compression device and slide off the undersleeve. If you have any concerns or questions, please contact the lower limb therapy team.